So today we are going to talk on spills. Now, in laboratory, there can be various types of spills. There can be biological spills and they can be chemical spills as well. In laboratories where they have got radioactive substances, then it becomes the radioactive spills. But we are not going to talk about it today. We are talking about biological spills today. And this is very common in laboratories, especially in the micro and the small laboratories, wherein handling of samples are generally, especially the tubes, which are like when it's removed from the centrifuge and removed either by hand or by forceps, it slips and you have spills. So how do we manage these spills is what we are going to talk about today. Okay. So just to basically let you know is like now spill, biological spill can be anything. It can be blood, it can be any of the body fluids. And these are especially if it's a hospital-based laboratory, you get a lot of such material, especially the body fluids like the synovial fluid. You can have the CSF fluid and all. And these can be potentially infectious, and it can cause a lot of problems, especially for the technicians who are at that place and who are not handling it properly, or even for the housekeeping staff who are not guided properly. So these kind of biological spills can also be called as the biohazard spills, and these need to be attended on priority. Uh, Most of the laboratories are trained and are also, if not trained, I'm telling you today that you need to have a biological spill kit. So this kit is very essential for no, keeping it ready whenever such an encounter, what we call, or whenever such an incident takes place. And this kit contains all the things which are required for cleaning up the body fluid or the blood, or what we call the biological spill. So just to basically start with, we can just think about what are the things that can be required. So when you start it from the top, you need a cap, you need goggles, you need mask, you need gloves, you need an apron, and you need closed shoes. Okay. Now, if there are chances wherein you have glass tubes which you are using, then in that case, the shoes have to be rubber shoes, which we also call as the gumboots. So the person who is going to do the biological spill cleaning of it should be wearing the gumboots. Uh, the apron that you have, it should be the plastic apron. Okay. And other than this, you need to have your red bags and your yellow bags. You need to have forceps so that you can pick up the glass if it's a broken glass, or you can pick up the tissue or whatever the absorbent material you have put, which we are going to discuss on how this fluid spill is taken care of. Okay. Now, the basic principle of the blood and the body fluid substances in spill management are the standard precautions apply that I just spoke to you about, the PPs. So you should have your list of PPs in your collection, in your spill kit, the biological spill kit. And the spill should be cleared up before the area is clean. Adding cleaning agents to spill increases the size of the spill and it should be avoided. So just remember that we have a general tendency that whenever there is a spill, we immediately start pouring 1% hypo on it. So do not do that, because the moment you are putting uh, hypo on it, it will start spreading. So there is a process which you need to do in order to reduce the area and at the same time even decontaminate it or disinfect it. Okay. Also, the generation of aerosols from the spilled material should be avoided. So do not try to either dry it with the dryers or try to wipe it roughly, because if you're doing it, if the housekeeping staff is doing a rough cleaning or a vigorous cleaning, then there are chances that these aerosols may appear, and that can be also potentially harmful. Management of spills should be flexible enough to cope with the different types of spills. So, as I told you that there are various types of spills. When you talk about chemical spills, the chemical spill kit will also contain sand in it, okay, and it will also have a special thick rubber gloves in order to avoid. So that's a totally different. When you have a chemical spill, you need to have a totally different kind of a kit, but you should keep these things readily available in case if there is an acid or a base spill in your organization or in a laboratory. You should know the nature of the spill. Okay, you should know even the size of the spill, which is very important, because it has two terms, like a small spill and a large spill. If it is less than 10 ml of blood spill, then it is a small spill. A blood or body fluid spill, then it's a small spill. If it's more than 10 ml, then it's a large spill. What could be the pathogens which would be involved? So if you know from what is the clinical history of the patient, okay. So if you are aware of it, you are much more cautious while getting the cleaning of the spill done and avoiding the people to come over there, the rest of the staff or the patients in that area. Okay. Now, what kind of a surface it is also equally important. And that's the reason why when we talk about making a laboratory or the infrastructure of a laboratory, then we always talk that you need to have non-porous surfaces. So wooden surface should not be there. It should not be on any of the there are some laboratories which have got wooden stool. I have seen in many laboratories when I go for an audit is that they keep the centrifuge on either a wooden stool or a wooden table. And if there is a spill, then these wood has got small pores, so there is a very high chance that these infectious agents may get embedded into these pores. Okay, and also the location involved. So where is the location? If it is a location which is in the phlebotomy area where there are other patients who are also coming, so depending upon that, how you have to cordon the area or how you have to restrict the movements in that area also needs to be known. So it can be in you can say in the common area, that is where the public are also accessible, or it can be in the laboratory area where there is a restricted entry for the people, for the outside people, but the staff are equally in danger, so that they should not come over there. So whenever there is a spill, the first most important thing is that you need to have an alert which is put up. So alert can be in various types. Okay, you can have alert like if you have those signboards of wet area, you can put it up. Second is you can cordon the area. That means you can restrict the area. How you can restrict the area is you can have chairs put around that so that no one stamps over it and takes it ahead. So the aerosol starts spreading if someone stamps and moves ahead with those infectious agents of blood or body fluid. The most important thing is that you should not use mops. Okay, it's a very common practice in the areas in smaller in B cities, in C type cities or tier 2 and tier 3 cities, that the housekeeping staff is called, and what they do is they start cleaning the area vigorously with the mop. So a mop should never be used. Okay, and all the body fluid spillage must be cleaned up immediately and effectively. So you need not wait for, if the housekeeping staff is busy, especially in a hospital setup, if the housekeeping staff is not available, then what the other staff or whatever the technician is, they start doing is that they try to clean up with cotton or with tissue on their own. So that is not the methodology. Even if the staff is doing, you should know the methodology of how to clean a spill. Okay, now hypo is considered to be one of the most potent source for cleaning. Okay, but you should know how to prepare a hypochlorite solution, because a concentrated hypochlorite solution should not be poured over the body fluid, especially urine. Because I have put this up because chloramine gas, which is a very potentially toxic gas, can be produced if concentrated hypo is added on urine. So it needs to be avoided. And preparation of 1% hypo, you should be aware of. You should prepare a chart. That is important because what is the concentration of your concentrated hypo which you're getting it from the market, whether it is 4%, it is 4.5%, 4.8%, or 5%. Or there are some cases wherein it's 10% also. So from 10% or 5%, how do you convert it into 1%? You should have a chart which is made. What you can do, the thing in the spill box, you need to have 1% hypo also prepared. Now, whenever we talk about, it should be a freshly prepared sodium hypochlorite solution. So when you're preparing a freshly prepared sodium hypochlorite solution, you can have two bottles. Okay, one will have only the concentrated hypo, and the other will have water. Now you should put that water and the hypo in such a concentration. Like for example, if it is a 5% hypo, concentrated hypo, and you are going to convert it into 1%. So you need to add 4 parts of water. So if I'm preparing, if I have to prepare 100 ml, then I'll add 20 ml of hypo, that is concentrated hypo, and 80 ml of water. So I keep these two bottles ready. One is with 20 ml of hypo and second is with 80 ml of water. And whenever there is a spill, I will prepare this, mix it up and keep it as a freshly prepared 1% hypo solution. Okay, this is for disinfection. Whenever a spill takes place, as I told you, the first thing what you're going to do is you're going to cordon the area. You are going to restrict the area so that no one comes in that area. And then you should wear your personal protective equipment, which includes the gloves and aprons. If it is somewhere you feel that it is the uh, blood or body fluid has some kind of a toxicity or it's an infectious material, then in that case you should even wear your mask as well as your cap and goggles. Okay. Now, any of your wounds, especially it is very common in the housekeeping staff as well in women. Okay, most of the women who work in kitchen and yeah, they are using knives, they have cuts, small cuts, especially on their thumb or in the first fingers. Okay, because of the cutting technology method which they are doing. So there is, may I request you all to please mute yourselves. So there are chances that if in case you are not wearing gloves, then these areas are open and there is a risk of infection getting into your body. Okay, so in order to avoid it, if you have any cuts, then please have a waterproof dressing which is there on that particular cut. Do not keep it open, especially when you're working in a laboratory. Adequate ventilation is required, especially when you use hypochlorite solution, because hypochlorite solution, it has those fumes which come, and these fumes can be irritating to the respiratory canal. By following instructions, the hypochlorite solution, earlier it was 24 hours, now it is very clearly mentioned in the latest guidelines that hypochlorite solution can be used maximum within 8 hours. So whatever you're preparing, it has to be used within 8 hours. Most of the organizations like hospitals, big hospitals, they have a common housekeeping protocol wherein with every shift, they have freshly prepared hypochlorite solution and it is sent to the various departments. However, the method that I told you is the best. You can keep concentrated hypo at in the ratio of 1 with water in the ratio of 4 if it's a 5% hypo solution. So you can freshly prepare at that time only and use it. That is the ideal way. The reason for using it within 8 hours is that over a period of time, water reacts with sodium hypochlorite and nascent oxygen is released, and what you get is sodium chloride. Okay, so NaOCl, the O goes away and you get NaCl, and NaCl is saline. So the potency of the hypo solution is reduced. So it will no longer be acting as a disinfectant. It will just be like any other water or saline solution which we have. So you should have this freshly prepared sodium hypochlorite. Okay. Any remaining fluid which you have prepared should be discarded and a fresh kit should be prepared after every cleaning method is completed. You need to promptly clean and decontaminate the spills of blood or any other potential infectious material. So whenever a spill takes place, now uh, I'll just tell you with respect to, I don't know, because we may be having a mixed crowd. There may be people only from a laboratory and there may be people from a hospital-based laboratory. So hospitals and now even laboratories have certain codes. Okay, like the code red, code blue, code yellow, code orange. So what code have you designated for a biological fluid spill? So if you say that code orange is my biological spill code, then you need to activate that code, so that the people are ready to come and clean, especially the housekeeping staff. And if it's a small laboratory and you do not have any such code mechanism, then the method that I have told you of that is of cordoning the area and getting your biological cleaning fluid cleaning kit, which we had prepared initially, and then you should start using it. Follow the proper procedure for site decontamination of spills and body fluids. Now, what you can do is, in this case, for the laboratory people or small and only the labs, is you can have a spill cleaning protocol prepared and pasted it in the various strategic areas. So every laboratory or every area where there is a chance of spill, and also including phlebotomy area. Okay, so when you're doing this, number one is, as I told you, first thing is you have to wear your protective equipments, that is the personal protective equipments, right from the gloves to the shoes. And in case if there is glass, then you need to wear gum boots. And in case if there is a potentially harmful or very strong kind of chemical spill, then you need to wear rubber gloves also, the thick rubber gloves, which generally, if you have seen the people who are cleaning by the municipality people, they wear those orange thick gloves. So these gloves should be worn. If the spill is large, okay, then it has to be cleaned in a different manner. As I told you that there can be small and large. That is, the cleaning will vary for both the areas. Now, a small spill, I told you, less than 10 ml. So cleaning of that first we will talk about, and then I will tell you how a large spill needs to be cleaned. Okay. Now, whenever there is a small spill, you have cordoned the area, and wherever you see the blood or the body fluid spills, okay, please place an absorbent material over it. Cover it entirely with an absorbent material. So what are the absorbent materials that we have? We have tissues, we have cotton, we have gauze, we have newspaper, we have cloth, um, uh, anything that absorbs. Some people also have sponge, okay, but that is not what we are using. The ideal thing is tissue, cotton, gauze, or even cloth. Okay, so cover that area with that, so that it does not, aerosols do not get into the atmosphere, and it does not cause infection. Okay, once you have done that, then you can use the hypo solution. Also remember that in case if there are any broken glasses, do not pick up the glasses with bare hands or even with hands with gloves, but use forceps. If you remember, I told you that in the kit, the spill kit, we need to have forceps also, and we need to have something to uh, take it. Like now, what generally we call either a soup or supri or something, like people call in their local languages, something to gather it and collect it and throw it. Okay, so use that, and never use bare hands or even gloved hands to remove the sharps or the broken glass. Now, once you have covered this with the absorbent material, you would be adding the 1% hypo solution and pour it from outside to inside. Okay. Now, there is a reason for everything. When we are doing phlebotomy, you remember what we do is we take cotton and spirit and we clean from inside to out. Okay. But in case of a biological spill, what you're going to do is, once you have covered the entire area of the spill, you will use 1% hypo from outside to inside. And what is the reason behind this is that whenever a spill, whenever you are pouring something, due to the viscosity, the fluid starts spreading outside. So when you pour it, the blood also starts moving outside. But when you start from out to in, then it gets restricted inside, and the hypo solution acts better on the uh, fluid which has spilled. Okay, so you should pour it from outside to inside, 1% hypo. Also ensure that this hypo doesn't fall on your clothes or on your bare skin, or it does not have those spills or the aerosols into your eyes or nose, because this is slightly toxic. It is an irritant. It can cause you respiratory irritation. When you have done, you then keep it for 10 minutes, a minimum of 10 minutes. If you think that it's a potentially infectious material, then you can keep it for 20 minutes as well. Once you complete this, again, with your gloves in hand, there are two options. Number one is either you pick it up with a forceps and you put it in the yellow bag, or you take kind of what you can call um, something which can gather it, maybe a hard cardboard or some plastic slide type, which you pick it up and you put it into the soup, and you can dump it in the pan, what we call it as a pan. Okay, so you take it into the pan and you can dump it in the biomedical waste bag. Okay? And all this should be sent for an appropriate disposal. Okay, once you have done this, again clean the area. Once you have completed this particular process, again clean that area with 1% hypo in a normal manner. But do not use the mop. It has to be the same process. Okay, so this ensures that the area is clean, it is disinfected, so there are no chances of infection or any other biological threat to the people around, whether it's your staff or it's your visitors, that is your patient. Now, when we have talking about 1:100 dilution, that is if it is concentrated, it's the bleach granules. But if we are talking about 5% locally available solution, which is there, the hypo solution, which most of the people use in the market, no one prepares it from the granules. Everybody's using the prepared hypochlorite solution. So when you're doing that, ensure that you have the dilution ratio which is mentioned. So this kind of a infectious material destroyer, or you can say a germicide, you should have an entire protocol of preparation. Your housekeeping staff should be trained on how to prepare a freshly prepared 1% sodium hypochlorite. Now, if at all this hypo solution, it spills on your body or any part of your body or your clothes, immediately go and wash it with plenty of water, as much as water. If it's going in the eyes, you have to use your eye wash or the eye cups and clean your eyes for a minimum of 15 minutes. Okay, otherwise your sclera can be damaged. So be rest assured that whenever first of all, when you're using hypo, be very careful. In case if it has splashed on your skin or your eyes, then you have to, with copious amount of water, you have to clean this. Okay. So just to brief it up, the biological spills, you need to first donning and doffing. Most of us know, especially post-COVID. So you don your personal protective equipment. You remove any sharp objects with a forceps. Okay. You put the tissue on it, uh, encircle it with 1% sodium hypochlorite. Okay. Clean that area, wipe it after 10 minutes, and in case of more infectious material or you known infectious material, you can keep it up to 20 minutes, so 10 to 20 minutes, and then gather that area, gather those the tissues or the absorbent material and dump it into the biomedical waste, and again do it with the decontaminating it with a for the second time. So this ensures cleaning of the spill. Okay. Now, the health systems should have the health services or the laboratories or the hospital-based laboratories should have the management systems in place by training, okay, and by conducting mock drills in order to deal with the body and the blood fluid spills. Okay, and the protocol should be included in the procedural manual. So you need to have your SOPs defined. You need to have, if you have a process, if you have defined a process on whenever a spill takes place or whenever there is a danger, okay, of any spill, whether it's a biological or a chemical spill or a radioactive spill, then what are going to be the protocols? Your staff should be aware of this, trained on it, and repeated mock drills done at regular intervals, so that whenever such a situation takes place, your people are very well aware of how to manage it. Okay, thank you so much.